Hi, it's Dr. Noel Williams, Optimal Health Associates, Oklahoma City, Oklahoma. It's January 26, 2021. We're only a few days or a few weeks away from Valentine's Day. So that's my most exciting news. But let's talk about COVID because I'm getting worn out by the masquerading people who act like they're intelligent and scientific and don't know anything and don't remember anything and are horrible. And I just want to point out some things. First, I'm not an expert in COVID. I'm an expert in gynecology. I want to be very clear about that. I know it backwards and forwards, and I think anyway. But what I am is knowledgeable about COVID, and I'm knowledgeable about infectious disease, things that are interesting to me, and public health matters, and a variety of other things that interest me medically. And that's because I was trained at Ohio State, which, well, it was a crappy place to go to medical school because they were so awful. They made you think. And we were trained to be doctors first who just happened to be a gynecologist or happened to be a general surgeon. It was always being a doctor and taking care of patients. And that's what I've applied to this problem. And then I'm confronted with people who are idiots, and I'm tired of it. And my idiot tonight is not Dr. Fauci, even though I am going to get to him because he is an idiot. And for those of you who think I'm being political when I talk about Fauci, get off of it, okay? And there's a reason I bring up Dr. Fauci. He screwed up the whole thing. Everyone blames Trump. Trump's an idiot, okay? But who's a real idiot? Fauci and Birx, who did not provide the truth in Redfield. Thank God Redfield's gone, and the new lady, I think it's Walensky, she seems like she has more of a clue at the CDC, but no. I mean, did you see what Fauci did 2 days ago? He said, oh, we should maybe wear double masks now. He lied about masks being useful, very unapologetically admitted he did. That was the single biggest distraction and thing that put back mask wearing in the United States and caused the spread of the disease. But anyway, let's go on to someone who's much less controversial, but he is Dr. McCullough, because he's just not even usually worthy of even discussing. But I have to discuss him because he put a thing out about the vaccine that's just criminally insane. First, he said the Pfizer vaccine isn't efficacious and they did relative risk reduction. Dr. McCullough, you don't understand statistics on vaccines. That's how you look at them. What is the relative risk reduction, not the absolute risk reduction of a vaccine, because the overall incidence is so low. So you have to look at how many people don't get it relative to the ones who do. So a 95% risk reduction in the vaccinated group is pretty amazing. So let's look at statistics like live action. Let's look at Integris, the Integris healthcare system in Oklahoma, in the Oklahoma area. They have 7,000 employees. All through December, they were averaging over 120 to 35 infected employees with COVID every day. Out. Today, it's 30 because they've all been vaccinated. Or not all, but like 70%. And guess who's getting infected? The ones who don't get the vaccine. So that's the only shift. It hasn't been through, oh, they all got it, because it wasn't 100 new ones every day. It was how many were out. It's the change. They got vaccinated. There's lots of little stories now and studies coming out on this, and there'll be more and more. Vaccine efficacy is the relative risk reduction, how much it reduces your risk. It's different than other things. If you don't understand that, don't comment about it. Oh, God, drives me insane. Number two, and look at my January 17th post. It goes through, the studies are listed. Look at the graph and the change. The red line is the people who got the vaccine. They're going like this. We got the placebo arm here, the vaccinated arm here, day 10, like that, and it goes up. So it was about 0.2% got infected in this group. At 120 days, it was 2%. Over time, it keeps on going up and up and up. We'll see more and more data. It's how it is. Number two, Dr. McCullough said, oh, it's dangerous. If it's a 2% complication rate, 9 million people are gonna have serious adverse events. How many studies have you done, Dr. McCullough, to put out this to hundreds of thousands or millions of people? I've done 30 some trials in my office. There's adverse events, which is literally I get a rash. Oh, ow, ooh, ow, rash. And then there's more serious adverse events. There is a serious adverse event rate to the vaccine. It's well less than 1%. It's more like running about 1 in 500 to 1 in 1,000. There is a 2% adverse event. I had adverse events. My arm hurt. That's an adverse event. I was sleepy for 3 days. That's an adverse event. Those are not life-threatening adverse events. The actual adverse event rate for the vaccine is essentially less than 1 in 1,000. It's probably going to be closer to 1 in 5,000 to 1 in 10,000, probably 1 in 20,000. Who knows? It's going to be very tiny for serious adverse events. You don't try to get people not to do the vaccine because of that. Oh, I know why. Because you only want them to do supplements. I love supplements. I want to emphasize that. But I don't look at supplements as the preventive strategy of all time for COVID. Yes, I want you to do them. Yes, I always want you to do them. But for COVID, if you can get the vaccine, get the vaccine. I don't know how else to make it clear. I'm a contrarian. I've crucified the FDA. Stitt, who I really have come around on, and we met with his people again tonight. They're doing everything they can. And that doesn't make him a perfect human being, or them a perfect human being, or me a perfect human being. But everyone, I can tell you, is trying. They're trying to do what they can for the state of Oklahoma. And I think a lot of people, excluding a few people, federally are actually really trying. It's just they're federal employees, and now and then it goes awry. So I have to clarify something, that I got a very nice text or Facebook post from the Oklahoma County Health Department employee telling me to stop calling them to schedule your COVID vaccine. Someone, me, has been giving the wrong information and is causing a deluge of their phone lines. And I'm very sorry to the Oklahoma Health Department or any health department. Don't call them about the COVID vaccine. Go to their, the webpage?
You have to have access to the portal.
You have to go to their portal. So fill out your COVID risk. What's the thing called you go to? I should know this, but I don't. You go to the Oklahoma County webpage. There'll be a COVID site or whatever county you're in. Fill out the information, and then you'll get a level of where you are in the phase, and then you'll eventually get access to the portal. Don't call them. It's causing dismay and confusion because I've asked too many people to call. So just go to the website and it will be organized for you. And also feel free, if once you get your number and you can get a vaccine or start signing up, go all over the state to get it. At our meeting tonight for the task force with the state people, they want the vaccine done. So go. They're all on board. Guess what county in Oklahoma is the #1 county? It's Oklahoma County. 86% of the vaccines have been used thus far. Why? Because one, the state has integrated extremely well with OU, Integris, Saints, Norman, and Mercy, along with the Oklahoma Health Department. So 86% of the doses that have been available have been given. They're cranking it out. We had some plans tonight to do some work on some mass vaccination strategies for Oklahoma County. We're working on that we brainstormed a little bit on Tulsa. We can't do a lot to help Tulsa. Tulsa's its own kettle of fish, as the saying goes. They have not integrated their healthcare systems like we did, and a big hats off again to all the CEOs, Jim Gephardt, Richie Splitt, Chuck Spicer, Joe Hodges, Tim Pearson at these different institutions in Oklahoma City, OU, Integris, Mercy, Saints, and Norman. I think I hit them all. Oh, Midwest City has participated, not quite as much. But they've all been fantastic and are working hard on everyone. So that's the big thing right now, is get your vaccine when you can. Take your supplements when you can. The British variant is here. The vaccine looks like it works on it pretty definitively. I think there's going to be really good protection if you had a prior infection. Again, the continuing data out of the South African strain and the Brazilian strain, again, the vaccine looks like it covers it. And then the highly likely, if you've had the infection, it covers it. So anyway, you don't want to get COVID. You don't want to get it. It's not a good disease to get. If you get it, it's looking like the post-hospitalization data is a 12% to 14% death rate in the next 5 months after you leave the hospital. Now, with good care and people being super focused on you, we can probably lower that, but we really don't want you to get sick. So Kim, what questions do you have?
Let's see. Why do you need to wait 3 months after having COVID to get the vaccine?
Really simple. A, you're not going to get it again within 3 months. You're probably not going to get it again within 6 months. You may never get it again. But if you look at it rationally, since you're not going to get it again within 3 months for sure, there's universal agreement, even from the federal government, oh my God, that they've agreed on something finally vaguely scientific. Not that that fact isn't very scientific, but they've actually kind of vaguely agreed on it. Why get it? Number two, you can react to the vaccine because your antibody titers are higher, and everyone's heard, I think reasonably, that the titers seem to come down and your antibody response fades. It doesn't mean you're not immune, it just means your abrupt attack is going to be lower to an antigen, and so you get the vaccine after 3 months so you don't have the same reactivity. I would say 4 months if you were hospitalized or were more severely sick. We don't want problems with vaccine side effects. That's the group I worry about with vaccine side effects, is people who have had it recently, people who are severely anaphylactic.
Okay. What have you heard or do you know about post-COVID cognitive decline?
Oh, so that's really straightforward. When you get inflamed, the inflammatory mediators cross into your brain. COVID crosses into your brain too. So it can cause inflammation in your brain. If you have inflammation in your brain, your cognition is going to go down. There's another issue though, and that's these microthromboembolic events. You can have multiple thromboembolic events to the brain and have like a whole bunch of mini strokes. So those are the things you have to look for, and that's why we always want people on fish oil, and we want people on fish oil or aspirin when they get COVID to help limit those types of events.
What if you can't find a second vaccine?
Okay, if you can't find a second vaccine, you will eventually find a second vaccine. We have, again, being that I take care of a lot of people, some of the people were checking their antibody titers before they even get their second vaccine. And so far, everyone we've looked at, but it's only been like 6 or 8 people so far, have been elevated already. So that's great. We would expect 95% of people roughly to be elevated already with just one vaccine. That doesn't mean they're definitively immune, but they're probably definitively immune. But you give the second booster to just make sure you're really, really tuned up. So you're going to eventually be able to get the second vaccine, so get it when you can. The first one's, I think, the meat and potatoes.
How do you feel about the vaccine during pregnancy?
Okay, the vaccine during pregnancy. So my friend David Chansome, I called because I had someone who was pregnant who wanted to know, and he's head of infectious disease at Integris. His opinion is it's totally fine. I think the essential opinion from the American College of OBGYN is essentially fine. If you look at the data, there's no scientific data to show if it's fine or not fine. If we look at the people who were vaccinated thus far in pregnancy, inadvertently in the first trimester, as they started the studies with Moderna or Pfizer, there hasn't been any harm to the babies thus far, but I don't think there's been any deliveries yet. And it's not a large group. So we have to kind of be careful. I think the recommendation ultimately would be to get the vaccine if you're in a higher risk category. Pregnant women definitely can get sicker with COVID sometimes, just like with pyelonephritis or kidney infections, they can get sicker than a normal person. Not that pregnant women aren't normal. Okay, they are. But the point, that's OB-GYN humor. So the point is there's vascular changes and permeability changes in the vascular system when you're pregnant. So inflammation and infections can get worse. So I would generally encourage people to get that. But again, it's a little bit of an unknown, unknown. But we do know it seems like there's a higher miscarriage risk and potential stillborn risk in people who are pregnant who get COVID. So again, we want to limit that.
Okay. This person tested positive in October, and now they're not showing any antibodies. I know you've talked about this in the past, but it's always good to review.
So antibody responses are acute and turn chronic, but ultimately what happens is you go through your T cell and B cells, and they get selective and trained to respond to the antigen or the protein on the insult. So in this case, the COVID antigen, the S1RBD section of the spike protein. And so those antibodies come up, and then as the infection fades and the person recovers over several months, those fall off. But the data that I've put out on January 17th, again, which were some papers, you can just scroll back a week and look at it, clearly shows that you get a long-term immunity without the antibodies, because you get B memory cells and plasma cells, and then you get the germinal lymphocytes that retain memory, just like other and they use the equivalent of the vaccination levels in terms of when you look at the vaccination levels of trained germinal lymphocytes from other vaccines and compare them to the germinal cells from people who've gotten COVID, they're the same, thus correlating to probable long-term immunity. So the actual antibody thing isn't as important as your B lymphocytes getting trained in your plasma memory cells, which is what happens 95% of the time.
I'm scared to ask you this. Herd immunity. What numbers do we need to get to?
Herd immunity. Okay, that means there's enough of us have gotten it that we can't really spread it anymore. So the lying lies, liars tell. Fauci said 70%. Because the RO of the virus is 1.1. That's classic data. It's very straightforward. It's statistical stuff. He's edged it up, and he commented, well, I try to edge it up all the time just to get more people vaccinated. So everything is a lie. It's 70% currently, 70 to 75%. And I got to be honest with you, I look at it differently because I have read so much. And again, the government scientists ignore data that goes against their narrative. Data set 1, 30% of the population has cross-reactivity and partial immunity to full immunity from just having corona cold viruses. Data set 2, a large majority of women who've gotten measles, mumps, and rubella vaccine have at least partial to full immunity also. You figure that number combined has to be at least 30% based on the data. So how many people need to get vaccinated? Well, since in the United States we have about 20 million people who've been infected, you figure 3 times that many have actually been infected minimally. It could be 5. We have 60 million people who are infected. The CDC data would more point towards 100 million, but let's say 60 million. So that would leave 240 million roughly. You figure about another 20 million have been vaccinated. So we're at about 80 million. So that leaves about 220 million. You figure about 70 million of them have some kind of cross immunity. That gets you to 150 million. So we probably need somewhere around 60 to 80 million more people vaccinated, and we'll really be at herd immunity. It may be 100 million, it may be 60 million, but somewhere in that range, it's really going to fall off. So if Joe Biden gets done what he says he's going to get done, which is 100 million vaccines in his first 100 days, we could be in pretty good shape by April 1st, which is what I've been hoping for and predicting. But the vaccine rollout's been a disaster, so we'll leave that alone. And then talking about vaccines, the only vaccines we have are Moderna and Pfizer. And when I'm talking about vaccines and recommending them, I'm only talking about those 2. I'm not talking about any other ones. I will discuss other ones as they come out, but I have grave concerns about the AstraZeneca one. That's the Oxford AstraZeneca one. And its studies are totally different than the other 2. So I would not, at this point, encourage that vaccine if it gets approved, by the way. So we'll just have to wait and see what happens.
2 more vaccine questions. This one's kind of specific, but this person's on weekly allergy shots, but anything else that caused you to have an immune response, would they need to work on the timing of their vaccine, or is that going to interfere or cause them to have a bigger response?
I will have to check on that. I do not believe it would have any problem for them, but I will need to check and see if allergy shots are a problem. We're holding off on other vaccines. We want them at least 2 weeks apart. That's kind of the minimal. I would kind of usually wait for, depending on your situation, if you're a high-risk patient. If you can get a COVID vaccine, just get it. But if you get the COVID vaccine, I'd probably wait 4 to 6 weeks before you got like your shingles vaccine or another vaccine.
This is an interesting question. This person says, I'm not clinical. My uneducated question, why not give a recently diagnosed person the vaccine, if it causes the body to respond and build the same antibodies, pretty much wouldn't it help fight the disease after they just tested positive?
And that's a very good question. And so that's kind of thinking of the vaccine like the shingles vaccine, which is how I do think of it for people who already have had chickenpox, and you give the shingles vaccine to augment their antibody response. Well, in the first 3 months, their antibody response is already really strong. So what you don't want to do is over-rev. That's what I'm worried about, over-revving the antibody response. So that's why we want to wait. They don't need their antibody response over-revved in the first 3 months, whereas after 3 months, as it really starts to come down, re-stimulating it could boost it I think, much more safely. And again, we're in the land of theory. 99% of people who get the vaccine who had mild disease within the first 3 months are going to sail. I mean, my son, the dentist who here in Oklahoma City, Noel, when he got his vaccine, he'd had it in June. He had almost no response to the vaccine, but he was more than 3 months out. I would rather we were more than 3 months out on people getting the vaccine because you don't need it and it's safer, theoretically.
Okay, one more.
Did that make sense?
Yeah.
Okay.
And this isn't vaccine.
Thank God.
Vitamin D levels.
I like the vitamin D levels 80 to 100. That's optimal. It's anti-neoplastic, it's anti-inflammatory, it's antidepressant. It is great for your vascular system. It's great for your brain. 80 to 100, 80 to 100, not 50, not 60, well, 70 is okay, but 80 to 100 is optimal. 80 to 100. And that's it. Is that it? All right, that's a lot. 21 minutes and 44 seconds. If you watch the whole thing, you get a gold star. Have a wonderful night. And sorry I was riled up, but Dr. McCullough just needs to not be called a doctor. Good night.